is going to be great.
It's going to be awesome. I got my coffee.
I got my tea. We got our dog by our feet.
Yep.
Just wanted to be a part of the action. So let's start.
Let's do it.
Okay. So hello, everybody. My name is Becky White. And today I have my first in-person interview with someone I know pretty well. My wonderful husband, Drew. And a little bit of background, when I started this podcast, a lot of moms were asking me, when are you going to share your story? I'd love to hear more about your son and what you went through. Some of my friends were offering, I'll interview you if you want. And I went back and forth thinking that was, that is a good idea. I should share my story. I'm asking all of these people to share their story. What about ours? And then, I was thinking maybe I should just record it by myself. I have a set of questions that I can just ask myself. And I'll talk to myself for an hour and a half, but then
I do that usually.
Exactly. And then I was thinking, who would be great to have on? Drew, my husband.
What a gal. What a nice thing to say.
And I think it's important because, I've had a lot of moms on so far, but I haven't had a dad's perspective.
Yeah.
And I also haven't had a perspective of a husband and wife, what it does to the entire family,
right,
and how to continue this day in and day out.
And I'm sure their perspective was like just as the caregiver or as the mother versus like the dynamic that kind of shifts with your spouse. Yeah, I appreciate you having me on, and it means a lot to be here and to be able to share this with you, and also to try to like see the lens in which you view kind of what happened and how things played out. Not just for the listeners, but for me and you to kind of like soak in on it a little bit and see what kind of pops up.
Mm-hmm.
Or it's interesting because it's been 8 years. So it's like, that's a long time, and the things we worried about then, some of the things we still worry about now, but some of the things are different.
Important to kind of go back and look at where we've come, where he has come.
Yeah, totally.
And all that he has overcome. So
oh my God, yeah.
To get started, I just want you to introduce yourself, tell the audience who you are.
Sure.
And if you had to use one word to describe Gabe, what word would you choose?
Well, all right, I'll introduce myself first. Yes. So Drew White is my name.
Drew White is your name.
Is my name. I don't know. What do you want to know about me?
What do you enjoy? Right now, what do you enjoy?
I like reading. I like running. Yeah, I like working out and be active.
That's another podcast episode.
Career, yeah, all that stuff, yeah. So that's me. But yeah, I love being with you guys. If I could use one word to describe him, oh man. So he is a warrior.
For sure.
But I describe him as amazing. He makes me laugh so much.
So much. I had to interrupt them. Drew was putting Gabe to bed last night, for example, and I was in Gabe's room putting some laundry away, and I just heard them laughing for about 5 minutes in the bathroom, not starting the bedtime routine. So I poked my head in just to like see how cute they both were. And when I opened the door, they both just kind of turned and looked at me.
Like we're in trouble.
Like Mom's here, and we're supposed to be getting ready for bed. But
I totally know. I can't help it.
If you wouldn't mind, in your own words, describe what it was like once I got pregnant and when we first had that ultrasound.
So when we first found out you were pregnant, it was awesome. It was something that, we had been together for, a while, and we'd been married, a couple of years at that point. And it just felt like, it was what we were meant to do for us. I had, a lot of nieces and nephews growing up, and I was super excited about the idea of being a father and being a parent. So from like that point up until our first ultrasound, there's nothing but, anticipation and excitement. And not that changed once you had your ultrasound, but it was, a different level. It changed in certain ways. You have this 3, 4, 5 month buildup to this first ultrasound, and you're thinking about all the things, and just being a guy and being into sports and stuff. You're thinking about all those possibilities, or, a daughter and all those amazing things too. And we said we wanted to find out the gender, right? Yeah. So we started the ultrasound, she said, you guys want to know the sex, right? And we said, yeah. She's like, all right, it's a boy. I'm like, all right, we're so excited.
I remember you jumping in the corner of the room.
Oh, really?
Yeah.
See, that's funny because I don't even remember that.
You jumped in.
You didn't jump. You couldn't
I
jump
did
at that
not
point.
jump.
No. See, I don't remember that.
Yeah.
And then she wasn't like an uncomfortable or awkward silent. Like she was like professional. We didn't have any reason to think anything different. She did what I think, you should do. Just very professional with like, not like a cold heart. We think the baby might have spina bifida. And like, I know my heart sank. What did you?
I remember her coming in the room and just a little bit of backstory. I was planning to be a natural birth. I wanted
You need a doula.
A doula. Like
Yeah,
we were planning.
Did all the birthing
like,
classes and everything.
We did the birthing classes. I was like, I'm going to go all natural. That's how I want to try it. And then at the last minute, if I need an epidural, we'll go for it. But I really did want to try natural. And so that's why we were going with a midwife. And I remember her just coming back in the room and she was like, we found that your child may have spina bifida. You're now going to go to a second level ultrasound. You can't be seen here anymore because now this is a higher risk pregnancy. And then I just remember thinking, we asked her, we were like, well, what does that mean? What's spina bifida? And she goes, I'm sorry, but we can't see you here anymore. And then she didn't really answer us. And then we went home.
Yeah. And so like, to me, you hear it and you're like, all right, I've heard that, like you've heard spina bifida, you've heard muscular dystrophy, you've heard these terms, but it's like, you don't really necessarily know what they mean. But I didn't, I didn't actually know what it meant, but you had like this idea of what it might look like. And so, you go to the Google machine and you start figuring, looking at things and just like
the worst.
Yeah. I mean, I think anyone in that position is going to do that.
Yeah.
You're looking for answers. It also isn't like productive. It's not really going anywhere for you, And so, but we got home and, I know I looked up, like I said, looked up stuff and I just spent the night crying, and just spent the night panicked and worried and feeling all those like, I guess, initial like feelings of guilt and like, I must have done something to do this or deserve this, or to realize like those things aren't true. But when you're in that position initially, and I mean, obviously, again, none of that's right, but it's at natural. Least for me, that's how probably because I feel like I'm in control of my life, which, really not, but you feel like you are. But then on top of that is also the fear of not knowing what's going to happen next.
Right.
But then seeing what reading what you read, you're like, well, I know this isn't going to be good necessarily. But at the appointment, she said, you got to come back for the level 2 ultrasound, right?
Yeah, but
and
that was clinic.
It was at a different clinic, but it was going to be like 2 days from then. So Wednesday was the original.
Yeah.
And then we had to come back on Friday.
To a different clinic.
To a different one, yeah.
So tell me what that was like for you. What do you remember?
Well, I didn't sleep for 2 days. It was like a blur those days, And you felt like you were in a bubble, like you had all this like pain and fear and all these emotions that no one else could understand. And also you didn't want to share yet. You weren't ready to, but you also weren't ready to share because like you didn't know.
Right.
A 5 or 10% like part of my mind that was like, well, maybe this isn't right. Like maybe we'll go to level 2 and they'll find something different. Like not like silly hope, but like,
never know.
People make mistakes and they're going to do this other one and maybe they'll see something different. Not like, oh, this can't happen to us, but more like, oh, it is a possibility,
So after we get the diagnosis and with the midwife, I know that the next ultrasound, we got it confirmed, and then we had to continually go back for more ultrasounds. And there was one ultrasound that changed my life forever. And that was with Dr. Carr. That was when we found out about tetralogy Fallot, that Gabe had heart defect. And I remember laying there and I was scared and I was sad and I was so confused on what was happening and if my baby was going to be okay. We had my dad there. Your mom was there. He's doing the ultrasound. He found out that Gabe had tetralogy Fallot, and I just started crying. And I was like, what does that mean? Like, he has a hole in his heart? So he has a hole in his back. He has a hole in his heart. And then I remember Dr. Carr just being amazing. And he drew a picture of what Gabe's heart looked like, where the hole was, what was wrong with it. Amazing.
So good and like kind in his words, not like condescending or anything. He was just like very kind.
And then I remember him grabbing my hand and he said, he saw how upset I was, and he just grabbed my hand. He looked me in the eyes and he said, "This isn't your fault. You did nothing wrong." It was exactly what I needed to hear in that moment, because I had been carrying around, as the mother, as the child bearer, I was carrying on this guilt of, oh my gosh, it's my body. It's something that my body did or I did to cause this. It's my fault. All of this is my fault. And by him saying it, just relieved that sadness I was carrying for the past couple weeks.
And he had finished drawing the picture, and then he turned and looked at me too, and he said, "This isn't your fault." And, you know, showed me that same kindness that he showed to you. And it's funny you said that. And I think this is like the good dynamic is with sharing the story together. You know, I'm sitting here talking about like how guilty I feel. You know, you're carrying those same things. And I think we share those things and we talk about that stuff. But it's nice that we're sharing this story together, because, you know, when I'm describing what I'm feeling, I feel like I'm carrying 100% of the guilt. And even though we've talked about it, when you're in those moments, you feel like you're carrying 100% of the guilt. Well, no, your spouse is carrying 100% of the guilt. It's like, well, it's not 200% of guilt to carry around. Like we should probably figure this out. You know, he's our child. Probably 50-50 would be fine. Like we don't need to have all this extra guilt.
As the months went on and as the pregnancy continued, like what stands out in my mind is that was a really bad winter.
Yeah, it was terrible.
It was the worst winter we've had in New England in a really long time. And we were driving at that point up to Boston.
And we only had to go there once a week.
Yeah.
Like what? Like what?
So we live in Rhode Island. And so it's about, with no traffic, it's about an hour and change.
Yeah.
But of course there's traffic
It's like
going to
2
Boston.
hours usually. Yeah.
So I remember that winter. I remember just being, you know, going to doctor's appointments, ultrasounds, making sure Gabe was okay. And I remember we were taking the MBTA up there a couple times.
Yeah, we took the commuter rail, and like
rail.
we didn't know what we were doing.
No,
man,
it was
if we did it
awful.
now, we'd be pros.
Exactly.
Gabe loves the trains. We know the train schedule.
Exactly.
But
then we got into our appointment. The one thing that really stands out in my mind was our clinic appointment. Our entire team.
Yeah.
So we came into this room at Boston Children's. The plan was we were going to deliver at Brigham and Women's.
He's a woman.
Mm-hmm. I would deliver, and then he would go to the NICU there and then get transferred over to Boston Children's.
Yeah, the main reason we planned to have him up there was we just don't know what the severity of any of these components will be. So it's better to just, you know, let's have him here. We'll have everyone coordinate. That way, if we need to be flexible when he's born and have a surgery sooner, then we can do it.
I just remember the last ultrasound testing where all the doctors wanted one more scan, one more MRI. And I'm 9 months pregnant. I'm sore. I haven't slept. I'm exhausted emotionally and drained and just scared. And I remember I was in the MRI machine just crying. And then I remember when they pulled me out, I was like, I need help. I can't get up. And just laying on my back for a half hour pregnant, it hurt so bad. And then I remember it was the last ultrasound of the day. We were in the dark in the last ultrasound room. You were holding my hand and I just started crying, like quietly. And I was just like, why is this happening? And mainly that, like, I hope he's okay.
Yeah.
I hope he survives, because we just didn't know.
Yeah.
I hope that these miracle worker, amazing doctors can use their gifts to make him okay.
Yeah.
And keep him here with us.
You know, as the husband and the father and the one not carrying the child, it's another thing that like I can't control and that I couldn't do anything about. I don't know what it feels like to be carrying our child and having all these feelings, and I can't do anything about it either, you know? And so to me, my initial reaction is like, well, then do something else to correct something else and try to fix everything else and try to make everything else like the right way and make everything else try to feel like normal, which we know isn't like a good word for us anymore. You know, what others may perceive as, you know, typical or something, you know, or what your mind created as expectations as, you know, becoming a parent. You're trying to do whatever you can to make everything else feel the right way and to be as like typical as it would be. And then I think that like makes things even more stressful, you know, because you're trying to fix things you can't fix. You know, I think at that point, you know, like it wasn't like we were having like, you know, we weren't having fights over things. There was just so much sadness that like weighed on us that it was just like difficult. Like our hearts were connected, but the stuff in our minds was like preventing us having clarity. But at the same time, like, how can you in that situation? Like you said, don't know what's going to happen.
Mhm.
And things are tracking okay. So they like felt comfortable just saying, like, a week before your actual due date, we'll do the cesarean. And
Yeah.
luckily it worked out
Yeah.
to that extent, like up to, all the way to
Mm-hmm.
that point.
Yeah. I'll never forget that day, obviously. I mean, both won't, but I remember waddling into the operating room, which was so bizarre. I'd never walked into an operating room, and they said, all right, lay on the table. We're going to give you the spinal tap. And they did. And they got me ready for the C-section. And then you came in. And then,
Yeah. And, so like you leave me and it's just like, holy crap,
this is happening.
And then they tell me to kind of get the scrubs on and get ready. And like my mom and Chrissy were with us.
Mm-hmm.
And so I don't know if now is a good time to say that Becky's mom passed when she was younger.
Yeah. So I was involved in a drunk driving crash when I was 14, and my mom and dear friend were both killed in that crash. It's obviously been a huge part of my life, and I miss her every day, and both of them. And so obviously this added another layer of just sadness. And I mean, when you go through something like this, you find out your first kid has multiple medical needs while they're still in the womb. Obviously, the first person I wanted was my mom, and I couldn't have her. So I have the best support system. They know who they are. And I have multiple mothers now that are like my mom, that carry me through life and support me. And one of those people is Chris. And so that was a big decision for me as we were leading into this. Is once Gabe is delivered, we knew he had to immediately go to the ICU, and I wanted Drew with him, who is going to be with me in that traumatic moment. And that's why I asked my dear friend Chris.
It's, again, like you said, it's another layer to this.
It's a part of our story. It's not just my story. It's Gabe's story. It's your story. And it's the fact that Gabe doesn't have a grandma. It's the fact that you don't have a mother-in-law.
Yeah, it's another resource we don't have, and I don't mean just like, somebody to watch Gabe, but it's another resource of like experience and emotional support. And I never met your mom, but like I grieve there, with you. But that's why you're so skilled with dealing with and working through so many of these things that I struggle with. It was different, and I never had to confront loss like that. Grief manifested in different ways and not always the best, whereas you were already like very skilled at working through grief. Grief is unfortunately a part of you, but in a way it's like your superpower too, in terms of like how it makes you like sympathetic and understanding and more patient, and just so many of those things that like, I struggle with. And so like I try to like educate myself, not in like this like formal like academic way, but like just reading other stories and thinking about what other people feel like. So there's like 3 books that like I read that I just, actually 4, but that I just like, I've read more than 4 books.
I've read only 4 books.
I've read 4 books.
Here they
are in order. So one of them's Death Be Not Proud, a young boy that was diagnosed with cancer, 30s, 40s, or whatever. And so his parents write this book about his boy, Johnny Gunther, that he has a brain tumor. And so Death Be Not Proud. The other one is The Road. And so for a father with a son, it's fiction. It's by Cormac McCarthy. I don't think I've ever cried so much. And if you have a son that's around like 8 to 10 years old,
holy moly.
Oh my God.
Like, I remember when you finished that
I
book.
couldn't even like get myself off the floor. The other one was Once More We Saw Stars, which was this journalist whose daughter suddenly died, and I won't get into it, and then the other one is When Breath Becomes Air, and he was a neurosurgeon that was diagnosed with, I think, like stage 4 lung cancer. His wife's pregnant. He writes this memoir, and he isn't able to finish it. His wife does. And so since then, his wife's been kind of on the speaking tour. And I remember listening to her on a podcast, and she said how like much it hurt when people would be like, oh, like he's in a better place. And she's like, what I tell people now is, when in doubt, describe. It's okay to say, I don't know what you're feeling right now, but it must suck. Like the last thing I want to hear when things suck is that everything's going to be great. If you and I are having a conversation, it's fine. Like you can say, hey, Drew, it's going to be okay. Like That's fine. You know what we're experiencing. Like, we're in this together.
An outsider
doesn't
not
know,
knowing what to say.
not knowing what to say and not understanding the context. You don't know what I'm feeling right now, you know? And so the last thing I want to hear is that you think it's going to be okay. But a lot of times people just can't sit with something. They can't sit there and just be like, wow, that sucks. Like, that hurts. And I don't know what to say. Like,
but I'm here for you.
I would love for someone to ever say that to me.
Yeah.
I don't think anyone's ever. There may be one or two occasions that somebody has said that, and because I don't want to write off like everyone we've ever talked to, because that's not the case.
No.
But generally, in older generations, you hear that a lot. Like, they're very quick to just be like, "Oh, it's going to be fine," because they just don't want to. But we do have friends that want to sit with it for sure. I don't want to like paint this broad stroke.
No.
But when you hear it, you know, more than a couple times, you're like, "Oh my god, like this is terrible."
Or everything happens for a reason.
Oh god.
Why do you not like that phrase?
Oh, I hate it. I think I've worked through a lot of this. Like, definitely early on when people would say that, I'd be like, "Oh, okay, so someone being meant for my have these struggles, but your child to be healthy." Like, oh, how does that register in your mind? So what does that say to me as the receiver of that statement? That immediately tells me that like I'm not worthy or my child isn't worthy. That, at least that's how I take it when people say everything happens for reasons. Like, no, like things don't happen for a reason. They don't. I don't know. Like, to me, you give reason to the things that happen. Like, if we wanted to like sit around and not care, like then there wouldn't be reason in what has happened here. Like, the people that are in these positions, you choose to do better. You choose to work hard. You choose to give meaning to it.
But again, it's just a filler.
Yeah,
that people say because they don't know what else
totally.
To
Yeah,
say.
Because they're uncomfortable.
And
they're not. Yeah,
they don't mean it in a bad way, and we're not trying to be.
No, yeah, I wouldn't disparage people, but it's just
but
like
it's recognized that from this perspective, and for anyone listening that hasn't gone through something like this, in the sense of like a really medically fragile child, those words are sometimes hurtful when they're not meant to be. Being able to sit with someone's grief is so much more impactful.
Yeah, totally.
And to a family who's struggling. They're closing me up.
I'm staying. So you go, I'm with my mom and Chrissy. You go to the operating room, and then I wait outside with Chrissy because she's going to go in with you. So they deliver Gabe, and they bring him out, and I come stand at the head.
And he had dark hair.
And he had dark hair. And we were both like, this isn't the child we thought we were going to have right now, you know?
Who is this?
It was like,
and he
whoa.
was smushy.
Yeah, and you had all these like ultrasound images of what our child was. You know, he'd be in, you know, he's in your belly. He'd have his hands behind his head.
Yeah,
like he's so cool. He was so cool. So they, you know, deliver him, and we take our quick picture, the three of us. They put Gabe in the little
spaceship.
Yeah, little mini spaceship. And so I go with the nurse. We get in the elevator. We go up to the NICU. You know, they get his IV going. You know, there's one nurse that's kind of like assigned to him and maybe like one other child. She's doing her thing and kind of getting them all going. She was very sweet. And I remember her very compassionate, but professional, and, you know, give me as much information as we could. And I'm sure just like a deer in headlights at that point. But like, there's also a sense of peace of like, we knew he was in the right place. Cause now it's kind of like we're split up at this point. So it's kind of like, all right, it's me right now in this position while you're still, you know, recovering and obviously going through everything you're going through. I just remember like in the first rounds with the doctors, everyone there, and I guess the attending was like, we're going to do lab for 22q. And I was like, wait, I was like, what's that? I was like, how come I didn't hear about that before? And he's like, all right. So he's like, so he has a couple, you know, because he has the myelo and because he has the TET, he has like some fused ribs. He's like, we're going to do the 22q blood work, the genetic test. And he's like, you know, somebody else can talk to you about it another time. He was good. He was like appropriate. Mm-hmm. Obviously he had a job to do. He couldn't sit there to like teach me. And so I was like, oh, wow. Okay. And so so it was just a blood draw. So they did that, and maybe it took a few days. So he's in the NICU. My mom and my sister were up there. My dad too. And so like gradually as I worked up my rapport with this nurse, she's like, yeah, you can have a couple more people in. She, you know, let me have my mother and my sister up there, who are both nurses, who that gains them some sort of good graces. So that was nice, supporting me and you know, being there for Gabe too. And so, you know, it was tricky though, because like now, you know, it wasn't until he was probably like 12 hours old that they're like, oh, do you want to hold him? And I was like, yeah, I want to hold him.
Yeah.
And so they, they let me hold him for the first time. So the thing that's hard is like, our son goes that whole time without the feeling of his own parents, like what does that do to a child? I understand to an extent it was necessary for his care, and these medical interventions are what helped him survive and live a higher quality of life than he otherwise would have. But it's also things that really make it challenging, and you worry like, what did those things do to him, and how does he feel emotionally? Didn't have anything to eat, his IVs and blood work and everything else.
Yeah.
And so I remember seeing the Milo and looking at it and be like, wow, that's crazy. Myelomeningocele is I believe it's the most common form of spina bifida, but also the most severe. Spina bifida is literally an opening of the spine. And so in utero, that creates a lot of problems. And his Milo, so he had, basically had like this opening scab at the bottom of his, a fleshy, wound at the bottom, like right above his butt cheeks. And it was low enough. And so then it affects those nerve endings associated in that area. And so hence the neurogenic bowel and bladder, which we didn't have a full grasp of at the time at all. But just seeing that like fleshy thing, you're like, oh my goodness, like, looks like almost like a bullet hole. And so, the focus was on like keeping that clean. And I remember the nurse giving him a bath that night. And she's like, yeah, do you want to help? And I was like, yeah, of course I want to do. So like we gave him a bath together. We were Catholics, so we wanted to get baptized before his Milo repair because it was scheduled for the next morning. So we had our friend that's a priest come up and do the baptism. My mom and my dad and my sister were all allowed to be there by this nurse who was incredible. So way over the limit. And then you zoomed in. What we did, we video conferenced in, and you were there, virtually for the baptism. And so we did that night. I couldn't sleep you can't sleep in the NICU. So I didn't sleep there, but I came back down to your room. The plan was for the next morning to do the Milo repair. Dr. Worf, the neurosurgeon, one of his residents came up and we talked, about the logistics of it. And so I slept in the room with you that night. And then I got up the next morning and we got you in a wheelchair.
Yeah.
And you came up to the room and you got to hold him for the first time. And your dad came in too. That part I mostly only remember because I know there's a picture of it, the picture of the three of you guys,
Yeah, it's
just because so much of the stuff's a blur, So you go back to your room. I go with Gabe down to the OR into that waiting area. And so they took him in and I waited in the waiting area by myself.
What was that like?
I don't think it was terrifying because at that moment you're like, all right, he's in the best place he could be. I mean, Dr. Worf is just an incredible human being, and you're around him. You're like, this is what mankind should be. Like, this is the upper levels of mankind. Brilliant, gentle, kind.
Humble.
Yeah, super humble. It was lonely being in the OR waiting room by myself, and, maybe my mom popped in or somebody popped in. It's, a couple points, I don't know, 3-4 hours, like sitting there by myself. And then also feeling terrible that you're up there by yourself, but I couldn't go back with you because I need to be in the OR in case something happened. I was apart from you and I was apart from him. And that was a long wait. But like, what was it from your perspective? Like, were you just like resting? Obviously it was difficult, but like, what do you remember?
I was
were you
having
like
pina
sleeping?
coladas up at the room, relaxing, getting massages.
Yeah, right.
No. In all seriousness, I remember after the delivery, I had severe shaking after from the spinal tap, which was normal, but nobody had told me. I recovered and people were visiting, I was just out of it and grieving and sad. And so it was very weird for me. I felt like I had just gone through delivery, but I didn't have a baby in the room and I didn't have this connection that moms talk about of like, oh, it's you instantly fall in love. And I knew he was mine and I did love him, but I didn't have that like normal quote unquote connection because I was recovering myself. And I remember at one point after all the visitors and you were with him, I was alone in my room at one point and I was just like thinking to myself, this is so weird.
Yeah.
I should be with my child. Yeah. I'm having these weird feelings of disconnect. And it was just not what I anticipated when I imagined having a kid at all. Yeah. So I dealt with a lot of postpartum. I dealt with a lot of mixed emotions because it was so confusing emotionally.
Mhm.
I loved my son the second I found out I was having a son, but I never had that connection for a while because I didn't get to meet him for the first 24 hours until you rolled me down.
Yeah.
And I remember when they said, "Oh, do you want to hold him?" And it was almost like, "Of course." Yeah, like, "Yes, I do." But
It didn't feel
who
like he was
is
your
this
child
kid?
almost to a
Like,
certain extent.
yeah.
Yeah.
Like, you're telling me this is my kid. You're
Yeah.
telling me that this was the kid that you just
Yeah.
pulled out of me.
Yeah. Yeah.
He was super cute and
Yeah,
I
yeah,
loved him,
Yeah.
but it was hard. It was a lot of emotions and a
Yeah.
lot of sadness, grief,
It's
scared,
overwhelming, but you're also
overwhelming.
like physically,
Ugh,
you've been
in
physically
pain.
altered by what happened too.
Yeah, my C-section was, I think they made my incision a lot bigger just to get him out safely
Yeah.
because
Yeah.
of
I'm
the.
trying to be careful. Yeah.
So my recovery was just really, really hard. And I just remember it being extremely painful. You brought me back to the room and then I knew he was going into operation and it was awful and scary, but I couldn't, I was traumatized.
Yeah. Yeah.
I was in survival mode
Yeah. Totally.
and I was trying to prepare myself if something terrible did happen.
Yeah.
So I couldn't enjoy the moment.
No, I see.
At
How
all.
are you gonna
So
like? There's no way.
that was what it was like for me. And then you told me, oh, everything went great with the seal.
So he's done with the Milo repair, and the first person that came out was 8 hours old at that point, you know.
Yeah.
And she's like, he's a Worf, and then we heard from Worf's. I'm pretty sure Worf himself came up and was like, everything went well. When we'll follow up, sort of thing. And
Was he at Boston Children's now?
So the thing we should clarify. So he went from that morning. I went with the nurse. I remember this ride. Went in the elevator. Went down to 2 because that's where the bridge, the footbridge is from Brigham, and that connects Brigham to Boston Children's Hospital. So we went down the elevator, went across the sky bridge or whatever you want to call it, then went back, went into the OR there. And so then when he got out of the OR there, then he went up to the NICU at Children's. Yeah. So then you get discharged 4 days later. But over that period of time, it was like I was in this like world of elevators and towers and like just
Not
kind of
sleeping.
drifting through, and like going to the cafeteria and getting coffee and something to eat and going back to see you and then going downstairs and going up to see him and then going back downstairs and going back up to see you. And it's just like, I remember waking up in an elevator, like, the doors open and I was like, what's going on? And I'm sure that's kind of common for people that are in these positions. Like I just, I was trying to do my best to be there for both of you, and it's like, at the same time, it's like super solitary because like I don't know what you're going through exactly. Obviously, we're feeling a lot of the same feelings about our son, but I don't know what you're going through in terms of your recovery. So it's like I'd come up and sit with you and we talk, and then I'd go back downstairs. I'd get something to eat or whatever, grab another coffee, and then I'd get back in the elevator and go. Unfortunately, you were in adjacent hospitals, and I could walk between, and I could do that. And then at night, I'd come back and I'd sleep in the room with you. But then I'd go up to the NICU and kind of stay there. It was wild. Like he needed an extra IV line one day, and the nurse was like, "All right, yeah, we're trying to figure this out." And she's like, "We got to go to the line." And she's like, "But a little trouble is being
Which is very common between NICU.
not super vascular." And this nurse walks in, and she's like, "Yeah, I'll take care of it." And she like walked in and she put an intravenous line in his head, and I could not believe it. I was like right along, like between, like around the temple, like above the eye, like perfect, like place you could see it. And she just like put an intravenous line. And I was like, oh my God, like what is just happening in my life right now? Like
she was a pro.
She was amazing. And I was just like, oh my God, like how did this just happen? And so you're trying to learn, they have the latex, little things like they have the latex allergy sign up. You're like, why do they have a latex allergy? And they're like, well, kids with spina bifida, sometimes develop a latex allergy, just, precautions. And so we just went through these things. And I just, remember playing classical music on my phone, like next to his bed while I just like, I don't know, cooed to him or talked to him or, whatever I could to try to like make a connection with him and try to form a bond because like, he still was at a point where like, he's post-op now. It's like, can't really be held. He's got to be whatever position on his back. So like he had to be in certain positions for a certain amount of time and trying to desperately form a bond and connect with your own child. And it's just it was so challenging. Yeah. It was a lot of time alone. And then apart from him, you know, you can only be there so many hours, you know, and then a certain part of the human side of you is like, there's only so many hours you can just sit there without like your mind stirring too much, you know, looking at all these other kids like in the same position, having the flexibility where I could sit up there, but I was like staring at 3 or 4 other kids that like didn't necessarily have that,
Mm-hmm.
you know, and so it was tough. Keep your mind occupied while you're trying to like support your child and be there for him.
Mm-hmm. Yeah.
And again, it's a child that you like you said, like you know it's yours, but you don't know what it feels like. And maybe a lot of parents feel like that. And I know speaking to other dads, it's sometimes hard to make a connection, you know, with your children early on. But I think obviously this situation like made it even more difficult in some ways. Maybe in some ways it made things easier later on because like you have this like huge connection of like what we all went through together, but initially it makes it difficult just because there's this physical distance that you're
Yeah.
forced to keep,
Mm-hmm.
you know.
Those days are blurry, but will never forget when we had to start cathing him.
Yeah, so he had a Foley for the surgeries, and then they were catheterizing him, and they were, you know, testing
Mhm.
in and measuring in and doing all that stuff.
And I had no background as an EMT like you had, so I was terrified.
Well,
and
I'd never catheterized anybody in my
I-
entire life.
I
I didn't know
know.
what I was doing either.
But
yeah.
you were much more comfortable than I felt, or maybe I
No, I
assumed you were.
No, I felt the same way you did when they looked at us and was like, "All right, you guys are gonna have to start cathering him." And he's probably like, he's 7 to 10 days old, and we looked at each other like, "Wait, what? What do we have to do?" I think we knew that we were gonna have to do it at some point. We just didn't realize like it was like, "All right, now here's your time to do it." And like he needs you to do this sort of thing, and you're like, "Oh," but we both picked it up quickly, you know.
No, I did not. It took me like 3 months, and then there was this point where you were just exhausted, and you were like, "You got to learn." And you said exactly what I needed to hear. I didn't want to hear it at the time, but I needed to. I needed to learn how to do it, and you couldn't have all that on your shoulders, doing it alone.
Yeah, I remember like the first few times doing it, you know, but we learned. We had to learn doing every 3 to 4 hours, and it was all us. Like, and we did it all through the night. Yeah, and so at this point, you've been discharged, but we have the hotel next door, and so we take turns being with him. And so I had the night shift 90% of the time, probably.
Yeah.
Because you were just still struggling. You couldn't sleep in those sort of like
couldn't lay
weird
down.
pull out things. So you were sleeping upright in bed. So I'd have to like I'd wheel you back to the room, and the first few days I was picking you up and putting you into bed, and then going back downstairs, outside, back into the hospital at that point, going back with him, and then staying with him till 6 or 7 in the morning, and then my mom would come over with you in the morning.
Mm-hmm.
And then I'd like eat breakfast and then go back to the room and sleep during the day. And so it was like 2 ships passing in the night, like we were just always like, we weren't really together. We'd have a few hours in the morning, and then I'd come back like 2 or 3 in the afternoon. We have a few hours in the afternoon, the two of us just like taking shifts. Yeah, it was a lot. But you just survive in advance. You're just trying to figure it out, not to make it play it out like, oh, it was easy. And you care about your child, you care about someone, you do whatever you have to do. There wasn't anything more to it. It was like you got up, you did what you had to do, you cathed them, you fed them, you did, you started to learn how to pump. It's a whole nother thing which you can get into, but like you did what you ever had to do, and
I'll never forget you wheeling me to the hotel. I'm in my black dress and robe, and I'm getting wheeled out in the cold Boston air to our hotel, and it's like midnight or 11 o'clock.
Yeah.
And I remember just sitting in the wheelchair and just being like, how is this happening? How is this happening? Is he going to be okay? Is this our life? Like, is how long are we going to be here? Because when you're in the NICU, you feel like it's months.
Yeah.
You feel so isolated. You feel like the world outside is just like happening, and you're there. And that gave me perspective of families that are there much longer than we were only there for 2 weeks, but in the hospital. But it just gave me a different perspective of these kids that, are there for months, and just day in and day out. And I remember getting the diagnosis for a 22q. They gave us the results from the microarray test, and we were just kind of like, okay, what? I don't know. I didn't have like a feeling when they told me. I don't know if you did. Like, or were you just kind of like, okay, he has this. What is this? What does this mean? Like, there was no like, here's what you do now.
Yeah, no. But I think like at that point he's here, and you have this feeling of him, and so it was a little less scary than the spina bifida diagnosis and stuff before he was born.
Mm-hmm.
Because you're like, all right, well, I have a child and he's here and he was born and he's alive and we'll figure it out. But it was definitely challenging.
Mm-hmm. So yeah, then we got the diagnosis. He has 22q, and then we had to follow up with genetics and endocrine and ENT and all these other doctors. And then, speaking of ENT, I remember them coming in for the newborn hearing screening, and you were in the corner of the room by the window just taking a breather, which we both were doing and giving each other. And they came in, they said, we're going to do the screening. I was like, okay, great. And they're doing the screening, and then all of a sudden she looks at me and she said, oh, he failed the left. And I was like, well, what? And then she goes, all right, well, sometimes kids have fluids in their ears, but let me do the right. And then they tested the right and said, oh, he failed his screening. And I was like, well, what does that mean? And they go, well, you're going to have to follow up with audiology and see what that means. But in my head, I'm like, okay, so I was panicking.
I looked up and my mom's standing there with you, and you just like put your head down and like she put her arm around you. And I looked up and I was like, what just happened? Like, I thought it was just like a routine thing. I take my headphones off and then you like guys both turn and look and tell me. We were just like,
yeah, that he might be deaf. And he had been so quiet. I know that's very common for 22q kiddos, is that they're quote unquote good kids, they're calm kids, but it's just, and so I was like, okay, well maybe that's the diagnosis. But then my head's going, oh my gosh, he hasn't been crying or been so calm this whole time because he hasn't been hearing anything. And I was just in this other moment of like panic, this whole world of not even going there, that he could be deaf and what that meant. And I was really shocked.
Yeah.
Really shocked.
The results of that initial test is just like another layer for us at that point. And like another thing where you're like, all right, well, what else do I need to know? Like, this is a whole nother world I don't know about. Like, I didn't know anything about spina bifida. I didn't know anything about tetralogy Fallot, and I didn't know anything about the deaf and hard of hearing community. So it's like, what is going to happen next? But you know, that's a whole other process that, you know, we went through. But in the midst of all this, we're like, because you know they do that before you can get discharged with a newborn in Massachusetts. So we were like a day or two out from being discharged. And so I remember going out to the car. I go get the car seat. He's going to be fitted. We got to make sure like you get him strapped in. And that was like a stressful ride home.
Oh my gosh.
I don't think I ever drove so slowly and carefully in my life. Like, just so
much stress,
worried about what was going to happen next, and the cath, and they gave us all the instructions and the phone numbers, and worrying about this
and the medicines
and everything, worrying about all that. And then the other layer is, you know, breastfeeding and pumping and him eating and nourishment. Then all the markers to look out for with tetralogy of like, you know, the baby and tet spells and all those things that like we knew nothing about. Although ironically, like in the mid 2000s, I watched the movie called Something the Lord Made. And when we met with one of the cardiologists, they were like, trying to describe like what was going to happen with tetralogy. And they're like, yeah, there was a movie about it, it's called Something the Lord Made. And I was like, what? Oh my God, that's right. It's like, I watched the movie like 10 years before, 8 years before that. And I was like, and so I remember watching it and I was like, oh, wow, that movie was about my kid and what's going to happen, what needs to happen and the surgery and like the evolution of that surgery. So it was just wild. But like, that was like the most I understood about what was going to happen next. And so we get home and like, what are those days like for you?
I remember when we got home, your mom and you went upstairs with him and I sat in the recliner in the living room and I couldn't believe we just brought him home. Like I couldn't believe that our medically fragile kiddo was now in our house and we 100% had to take care of him. We had to cath him. We had to make sure that his heart was okay. We had to make sure that his closure on his back was clean.
Mm-hmm.
We had to make sure that I was shocked and in a really dark place personally, because I was still doing my own postpartum of just trying to navigate motherhood and then not wanting to mess up. It was just constant fear for me.
Yeah.
Those first couple months. Like, I wish it was just more like just joy of bringing a baby home and loving him. And there was a lot of unknown, a lot of fear. We knew the heart surgery was inevitable in the next couple months. We weren't sure when. They were monitoring him. And So that was like in the back of my mind, like, great, we have to do this all over again. We're going back to the hospital. We're going back to the ICU.
But it's interesting hearing you say that now, because like I think there were plenty of moments of joy in there, you know what I mean? And you never really, it didn't affect your parenting, you know? It didn't affect how present you were still there for him.
Oh,
You know, maybe
yeah.
that was going on in the background and that was definitely things you were feeling, but I don't look back on that and be like, "Whoa, you're in a," like I look back on, you were an awesome mother and you were there for him and you did everything you could and we did everything we could and we worked together. And
hmm
yeah, it wasn't always pretty, you know, like we obviously had our own struggles with one another, and
We made a rule that
made
anything said between 1 a.m. No, what was it?
anything after, yeah, between 1 and 6, like you can't hold against you.
Yeah, we didn't hold against each other because we didn't really mean it because we were so exhausted.
Yeah, I mean, when we're, and like you kind of said, I was primarily the one cathing him like 24/7 for the first few months, like first couple months at least. We weren't sleeping, you know, and then you were getting to feed him. And so like neither one of us was really sleeping.
Yeah.
But I don't look back on that and be like, "Oh my God, it was miserable." I don't look at it
No.
that way. I still look back on it with a level of joy and, I don't know, a feeling of like pride and accomplishment too, that like we, like, because you look at him now and you're like, kid's a rock star, you know?
Mhm.
He certainly has a lot of challenges today and he has a lot of challenges ahead of him, but he's a rock star. And it's like, well, because we did what we needed to do for him. Like we were there for him, you know.
Mhm.
He's amazing on its own, but he's a product of us as well. And we're going to cardiology and we're going to all these appointments and going to audiology and doing all these different things. Then on top of it, we found out that he had congenital cytomegalovirus, so maybe that was a contributing factor for the hard of hearing portion. And so they started him on that Valgan
Oh my
cyclovir
God, I totally forgot about that.
that they started him on, and that he just like did not
Hated.
tolerate. He had
Yeah.
just diarrhea and just like was so uncomfortable all the time. And this was like, maybe 3 months old. And finally, like, so you have all these physicians, and sometimes what they say is in conflict with one another without them knowing it. Sometimes, they all
Mhm.
want the best for what their, specialty is. And so the infectious disease people are like, well, he's going to be on the valganciclovir. And we're like, well, he's really not doing well with it. And so we had to be the advocates to be like, we're discontinuing it. Like,
Yeah.
we'll deal with the hard of
Repercussions.
hearing part, or the whatever the repercussions and consequences of this may be. Like, we'll deal with that when we have to. But it's not a guarantee that he's going to have these, like, that he'll have these super long lasting symptoms. But we know today that every time we give him the medicine, he is so uncomfortable for like 12 hours, like,
Mhm.
and screaming and crying and
Mhm.
not feeling good. And so we're like, well, we got to stop it,
Mhm.
And so we did that, so we had his cardiac repair scheduled in Boston for the end of August. We were supposed to, we ended up, or 2 weeks before, we had a rehearsal dinner. Remember,
Mhm.
scheduled for one of my best friends. We had a rehearsal dinner on a Wednesday night scheduled, and we were getting ready to go. Like, we were dressed. We were like
Mhm.
ready to go to this.
Yeah.
And he was like super uncomfortable, and he had like a, low grade fever. I'm like, what is going on?
Yeah.
Oh, we think he's got a UTI. And so, because he was so close to getting his TET repair, that we, from our cardiologist, like, you got to take him to the hospital, the Children's Hospital in Rhode Island. And we took him there, and I remember remember this, the ER was like a madhouse.
Yeah.
It was packed. And I just went up to the girl at the desk. I was like, my son has 22q, spina bifida. He's prepping for a tetralogy flow repair. And I think he has a UTI right now. She's like, wait a minute. She came back like 60 seconds later. She's like, come right in here. And so she like took us right into the first triage room. So he's, uncomfortable and screaming. So they able to like, all right, yeah, he's got a UTI. They put a line in him. They get him, kind of got him comfortable enough. And at that point, we went up to the cardiac ICU, and they're like, yeah, you're not leaving. Like, you're not leaving here. The only way you're leaving here is if you're going to Children's in Boston.
Mm-hmm.
So we're up there for a few days, and they get him kind of stabilized in the UTI side, get the antibiotic going for that. And they take us all up to Children's from the hospital in Rhode Island. And, we do we take the special truck for that, and we go up there. Yeah. So we get up there, and then we spent a few more nights, and they pushed up his repair like a week. We met with his surgeon, AK, the night before, And I just remember him being like, again, like Worf, just like, man, you're like the 1% of like human beings, like just so kind and gentle and humble. And you could tell he was skilled and capable. And so I remember AK saying that, like, I'm used to dealing, baby's like half the size, like we'll be okay. And he had that like Midwestern draw to him. But luckily, he had another successful surgery, and at least this time we were together.
Mm-hmm.
I think we were both more comfortable with what was happening. But it was still like so hard leaving him.
So hard.
When they wheeled him away.
Because we knew him.
Yeah.
We had 3 months with him and knew his quirkiness, knew what made him laugh. Like we knew who Gabe White was. And unlike the first surgery where you had just met him 24 hours ago, not even. And so that whole experience of the heart surgery was, I just remember just the hours just went by so slow, but he did okay. And
it was wild. Like when they got him all prepped and they take him away, and like he was kind of like, at that point he was almost like chunky, like he was kind of like stout. He's like a little chunky, and they wheeled him away, and it's just like, I remember squeezing each other. It's just like, we may not see him again, because he's going on bypass. They're gonna, perform these interventions to save his life, and they're gonna have to put him on bypass in order to do so. But once he was kind of out of our sight line, I was at peace that whole time.
I wasn't.
So yeah, I don't know what. I think again, it was much like the first time where it was like, this is the best children's hospital in the world, arguably, and we're with the premier cardiac surgeons. Once he went in, I was at peace the whole time. And it was, like 4 hours or 5 hours, whatever it was, of maybe 6 hours of like me, you, and my parents just sitting there and just waiting and talking. And, I stress eat. I just went to the cafeteria probably 5 times, then they get the free muffins and everything.
And then he came out, and I remember seeing him with all the tubes, and they even prepared us. They said, he has a lot of tubes and
a lot of swelling from the surgery.
He's going to be hard to see. And actually, one of our friends worked in the cardiac ICU in Boston Children's, so it was nice having her there.
Yeah,
because she kind of prepared us too, and it was just nice to have a familiar face. And
he's a little swollen from the surgery, and then he's got the 2 extra drains coming out of him. He's intubated still.
Yeah.
The IVs, there's so much happening. He's got the Foley again because of the surgery. It's like this.
But then I do remember afterwards, he was like such a happy kid.
He bounced back so quickly.
He felt so much better.
Yeah.
And he had so much more pep.
Yeah.
He was just more awake and more alert.
He wasn't, because at this point he's still not mobile, but he definitely had more energy. You're right. Yeah. Way more alert. Yeah.
Yeah. So that was just beautiful to see. And he did well though.
Yeah. That's why he's a warrior, and then
it was the hydrocephalus. That was like the next thing.
Yeah. So then the next big one was, after doing his MRIs every couple months at this point, Dr. Worf and the neuro team just, determined that he did have hydrocephalus. And so, so he had fluid on his brain. And so traditionally they treat that with shunts. But Dr. Worf was very, very skilled at this procedure called an ETV CPC, which is an endoscopic third ventriculostomy with choroid plexus cauterization. So he drills a small little hole in the skull, and then he goes in there and like creates a slit to release tension, and then he cauterizes another part, I believe, in order to kind of slow the release of the fluid onto that third ventricle. He didn't create the surgery, but he perfected it, and he is like one of the teachers of it. Again, what an amazing man this guy was, right? Like he goes to Africa on a medical mission, and he told us that his plan was just to stay there. And like this stuff we had to draw out of him, because we dug around, and he told us afterwards, he was like, yeah, I thought I was going to go there and never come back. But at the time he was doing relief of hydrocephalus with shunts, and the group that he was there with, when he like ran out of shunts, we were like, yeah, we don't have any more shunts. Like, you're gonna have to figure it out, more or less. And he's like, all right. And so he perfected this technique that had been used before, but wasn't really widely used. And had done like thousands of these things. And so before his procedure, we had already done this research, right? And so he comes in, he's like, I've done a few of these before, so don't worry, everything's gonna go fine. I was like, I looked at him, I was like, no, I was like, I read your case study. Like, I know you've done more than a few. He's like, yeah, maybe more than a few, but it had been like 5,000 or something he had done, something like insane. And this was in like the 1990s, and this is 20, whatever, 20 years later or whatever it may have been. And so Lord knows how many he had done at that point. And having him do that, again, just another layer of like, all right, he's going to be okay. And I remember coming out of that, and he was like, Gabe was watching like Mickey Mouse. He's like 9 months old at this point, and I remember him just being like so happy. But again, always like something. Like, remember we had a cath sooner. He had all this fluid. Remember, he was super uncomfortable afterwards, and like we couldn't figure it out. And
Yeah, just learning all of his things, and also learning as parents of a 22q kiddo what to look out for. Like you said, we now know when he comes out of surgery, we need to make sure we're cathing him more because of the IV. But that was something we learned, and we didn't know. Nobody
Right.
taught us.
Right. Yeah.
But these are all the things that we just have learned over the years.
Yeah, totally. And and then Sense and all his procedure Sense, we're like all over it. So
Yeah.
the two things we're all over is the cathing right away, and then any sort of issues with extubation in terms of removing the tube, and he's having irritation in his airway, and he's more prone to some sort of like croup-like incident and inflammation in the upper airway. So we're like very alert to that, which he did have one after his ureter reimplant. So there's another 22q thing too, right? So like midline disorder, these are things we learned and we didn't know it is. His ureter wasn't anatomically correct, and so it didn't enter into the bladder the way a traditional one would, and so he needed a reimplant. So we saw Dr. Estrada up in Children's, and he was like, yep, this is the fix. He's like, it doesn't come in at the right angle, so the bladder's not clamping down onto the ureter, and so the urine is backfilling into the kidney, and so he's getting these infections, and we need to fix it. But we had never known that, and no one else had really ever told us even to look out for it. But again, it's the right one, so I guess it was closest to the midline, and so that was the one that had issues, and he repaired it, and he has not had a UTI since. And so all those little things that you learn along the way that we weren't on our radar at all.
There's nothing wrong with getting a second opinion.
Yeah.
And there's nothing wrong with questioning a doctor either. You know your kid the best. And I think that's really important.
Right.
For parents that are listening of 22q kids, what is like the one piece of advice you'd give them navigating this world that you've learned?
I don't know. You just have to be willing to just go the extra mile, and not trying to make that sound like we're any sort of heroes or anything. But you just have to put the extra work in, and know that putting the extra work in is important. One, they need it. Two, overturning every stone, you may find something. Like you said, like it's just making me think of like second opinions. Like, it doesn't mean like running through walls. It means exhausting all your measures, and have the conversations and put the work in, and like put the work in with your spouse too, or whoever, your significant other, whatever, to figure that process out. I think you're always going to say, I wished I did something differently, no matter what. But I don't ever want to say, well, I wish, if I just made that extra phone call, like, would we have been better off? Or if I just drove another half hour and saw this doctor, would we be better off? Like, I wouldn't want to have that question. But in order to do that, it's hard. Like, I probably put this off too long, but you have to take care of yourself. Like, there's only so much you're going to hit a wall eventually. And like, you're going to hit a wall in different ways. Like, you could hit a wall physically, you could hit a wall like emotionally, you can hit a wall like in your relationship with your spouse. Like, there's different like pitfalls of like wearing yourself out too much. So, but maybe go the extra mile with yourself too, like of taking care of yourself, taking time to like go read or go for a run, or whatever you find enjoyment of that can kind of disconnect you from that world and those decisions for a little bit. Woodworking, art, whatever it may be for you, watching TV, who cares? Do something like mindless or mindful that can kind of like take you away from that world a little bit. And that does require going the extra mile. Cause like, it's easy to just be like, this is what he's going to do next. We're just going to do this. Like, but taking the time to communicate to your spouse or even to your child to be like, I need like 10 minutes or I need 20 minutes to do this. Cause it just needs. What do you think's been your biggest struggle navigating 22q?
For me, it has been feeling so isolated. With the diagnosis of 22q, before I met the 22q Family Foundation, it was extremely isolating in the sense of not knowing other families, not knowing other kids that have this diagnosis. And and feeling like you're the only one. That was hard for me. What about you?
Yeah, I think like being part of SPAGNI, the Spina Bifida Association for Greater New England. I think like finding that bit of community, and because of the pandemic, Gabe really hasn't been too involved with that, and tiring, but it's also super rewarding knowing that you're doing something about it, and like for me as like a fixer, that feels good to be able to like somehow, whether directly or indirectly, like impact the cause. But yeah, I agree. Like the struggle is like how do you, like we've been talking for 2 hours, like how do you tell people these sort of things in a normal situation in a 10-minute conversation? Because that's all people really want to, like, a lot of times can be capable of. We have amazing friends that I think have a good understanding of like kind of where we're at, but it's still hard, like just like we don't know what their life is like. We don't know the intricacies of their life. They don't know what day-to-day things we struggle with and things we think about. I mean, nobody can understand those sort of things. But then that I can also feel like my life is still complete and that we're a team on our own. Thing I talk about, like breathing underwater, it's a reference to a different book. Sometimes like you feel like you're drowning. You're trying your best to like tread water. And I use the title of this book, which again doesn't apply to 22Q or anything, but like I use it as like something for us to think about, like, why are we going to tread water? Let's just like go under the water and just learn how to breathe underwater. Like we know that this is our life, like kind of like like a Jocko thing, like embrace the suck sort of thing. Let's just go under the water and we'll figure out how to breathe. Like there's another world up there that is spectacular, the world we can be in. But then there's also this other world that we need to live in, of like it being really difficult and we just have to figure it out. And it took me a long time to get to this place of like contentment with this dynamic, and I still struggle with it, and I'm not perfect and it's super hard, but I think that is the way to like do it. Like for me, that makes sense. Like both of these worlds can be okay. There's this world that not everyone understands what we're going through, and then there's this world where we're in this together and we're going to be awesome at it. Like we're going to learn these new skills and new things to be the best parents we can be for our child. And it's going to be different, and we're probably going to feel like we're drowning sometimes, and it's going to hurt and it's going to be uncomfortable, but we're going to develop this new skill that is like our superpower. And that's the way I view breathing underwater. And that's why I look at it so well. And that's why I use it a lot, of like, a big thing is like, just breathe, like deep breaths and you figure it out, and just, but it's like, we're trying to live in a whole nother world, a whole nother environment that we weren't necessarily built to endure. So that's why I look at breathing underwater. We'll live in that world together, because there's so many awesome and amazing things about him and all kids with 22Q. But if you're so wrapped up in what they may not be, or what the images or the projections of what you thought life were going to be for them, if you spend too much time like projecting like, oh, I was going to be his little league coach, I was going to be his basketball coach, and that stuff still kills me. It still like hurts, but it doesn't make me angry anymore. Like it used to make me angry. Now it just hurts and I'm sad and I feel it and it sucks. Like I wanted to coach our child or children in sports and in a traditional role, because that's the image I had in my mind. So dealing with the grief of that, we deal with grief in different ways. It's like the death of our expectations. It's the death of what we thought parenting was going to be like, what we thought our child would be like. But once we kind of like feel those things and let them go, then the next step is embracing all that they are. And I think we always have, but just all those other things kind of get in the way, and they try to like interject into the progress you make or the things you're trying to enjoy. And it's really just like your mind kind of messing with you. That's what I think I've evolved into. And I hope that I can continue to evolve in that way. I still struggle and hurt and get mad when I shouldn't and stuff like that. And at least in my mind, that's how I can kind of navigate it, is like there's these two worlds and they both can be true and exist in this at the same time. It's just like, but I kind of have to visualize it that way for me.
I think that's beautifully said. It's taken us 8 years to get, and each of us are on our own kind of journey as parents too. We deal with it differently. And I think it's also important to say, like, Gabe's 8 now and he's the most amazing little boy. And he just is the kindest, sweetest little boy.
Everyone loves him. Yeah.
And I call him a little heart stealer because anyone who like interacts with him, whether it's a PT, OT, speech teacher, whoever it is, I don't know, anyone, babysitter, they all fall in love with him. And it's just, he's a heart stealer. Like he will love you and just want to be your friend.
Yeah.
He's an OT in speech and all the things, but he's walking around, which we weren't sure if was going to happen at first. And that has taken a lot. But ever since day one, like you said, he's a warrior and he always had a fight. Like he always was crawling, like army crawling at first.
Yeah.
He was always pulling himself up. Like he's never given up.
Yeah.
He is a beautiful little boy. And I just wanted to say that just so that people can just kind of visualize the amazing little boy. And he has the best little smile and the cutest giggle, and he just lights up our world. And we say to him a million times a day, oh, I love you, kid. Like, I love you.
And I think like you brought up an interesting thing in terms of like the people that fall in love with him and it's because like they just see him and is like, how do you talk to your family members or friends about your child, like about the diagnosis, about the things that you struggle with. And I, like my thing to that is like, just be with him, just see him and just be with him. Like, don't worry about the things that he's not because you thought things would be different. Like I had to struggle with that and grow through that too. I'm not saying I was immune to it, but just be present. Like there'll be things about him that will surprise you, like all these kids, like they all have amazing gifts to give. And just because their struggles are a lot and they're a lot for them, they have a lot of things that are, unique to them. You have to be present to enjoy them. And then just put those like preconceived notions or those worries or whatever it may be, like kind of put them to the side and just be with them, and because in a lot of ways, like he's got it figured out, man. Like he loves life. Like he just loves life. And yeah, there's certain things that are super difficult for him. He struggles with anxiety. He struggles, sometimes, or he was having challenges sleeping, and he was, the restless leg, like all those different things that come up, the exhaustion with academics and that sort of stuff. Sure, he struggles, but like he also knows like how to enjoy things and just be there. And so like you can learn from them too if you just take the time to be there with enjoying what they are.
I guess, we painted a good picture of Gabe, and I just wanted to ask you, Bub, is if you could go back in time to yourself in that moment of that first year, what advice or what would you tell yourself?
So I've thought about this before, but I look at it differently. Like I would give myself a hug. Like I look back sometimes and knowing what I know, if I was watching a movie about me, I'd probably be crying the whole time. But when we're in those moments, you weren't crying the whole time. Like you were just trying to figure it out. When I think about myself in those positions, like I feel bad for myself, like not like in a pity way. How the hell did we go through this? But when you're in the moment, you're not thinking that. You're like, all right, I'm going to go to this appointment because it's the best thing for my kid. Oh, I got to make it to 6 appointments and we're going to be in the hospital for 4.5 hours. And then we're going to drive like in 3 hours of traffic each way. Like, all right, we just did 10 hours. But like, yeah, I don't think I'd say anything. I know that's wicked, like a cop out. Like I would like just give myself a hug, like and just be there. The things that we thought we had to worry about when he was younger, like some of those things we haven't had to worry about. But there's been a boatload of other things that I never thought we'd have to worry about that we worry about, and things that we have to be concerned with that weren't on my radar when he was 1 or 6 months old. You just don't know. Like the doctors can try to paint a picture and that's their job and that's great. And they're trying their, like, you have to take those under consideration, but like, you also can't like obsess over it. You just got to keep going. Like you just got to keep going. And yeah, so I guess I would say something and that would be it.
I would give you a hug too.
Thanks.
I do want to close on a happy note with the goober. We call Gabe Goober. But I want to ask you, what has our son taught you?
Gosh. Like everything. He's taught me love, kindness, and patience. Yeah, he's taught me everything. He's taught me about trains and other mechanical objects of sorts, elevators and whatnot. But he's taught me about true joy and love and acceptance and empathy and, all that. And it continues to be a work in progress for me. Like I still have a hard time with a lot of parts of these things and parts of my growth, and the best of me is from him.
I love that. Well, thank you for being on the podcast.
Thanks. I was happy to be here. Happy to be here.
Well, thank you to my husband for sharing his perspective, and for all of our listeners, thank you for listening to our journey. We could have kept talking for another 4 hours just about school and our experience with the deaf and hard of hearing community, which is a huge piece of Gabe's life and our life, which will come on a later episode. But thank you for listening. And for anyone that would like to share their story on this podcast, feel free to reach out to me at 22qpodcast@gmail.com. And never forget, 22Q family, that you are not alone.